I'm Dr. Abayomi. I'm a radiation oncologist, and my presentation is on cancer control in Africa. Maybe that's not a good title. Actually, there's very little control of cancer in Africa. No, but I have my flash here. Okay. The problem that is becoming apparent is that there seems to be, now there's better control of chronic and communicable disease in Africa. And the cancer is becoming a major problem. And it's projected that by year 2030, about 70% of new cancer cases will actually arise in so-called low-resource countries, of which Africa makes a very major part. So, it's the second two. Yeah. So my presentation is on the problem that we currently face in Africa in terms of cancer. And I would briefly go over the scale of the problem. In 2000, okay. Now, this just outlines what I'll be speaking about, the scale of the problem and the stakeholders, and how do we approach finding solutions for this major problem, and how do organizations such as PACHA get involved. I know the PACHA Foundation is also engaged in missions abroad. So they are very well suited, to help the African countries in this major problem. Now, there was an estimated there were 500,000 deaths from cancer in sub-Saharan Africa in 2008, and new cases are projected to be about 1.1 million by the year 2020. The survival rate for cancer in Africa is extremely low, and most of the countries are unprepared to face this major challenge that is evolving. 75 to 80% of patients in Africa present with advanced disease. They have limited access to care. There's delay in presentation, often due to lack of financial resources, and also lack of access, lack of centers that can treat these cases. So we have to design strategies to address this major problem. The patients present very late because of lack of access. There are no screening services. There's delayed diagnosis and lack of treatment facilities. I know you guys, this is lunchtime, but unfortunately, this is the type of presentation that one sees in Africa. Most of the patients have advanced disease. And as you can imagine, the suffering that these patients present with in terms of the lack of, they obviously cannot be cured. And unfortunately, there are no palliative services for them. There's no hospice care. So the problems are quite major. This is I'm just to illustrate this problem. There's a study from Yaoundé General Hospital that was published by Dr. Ndom, where over a 2-month period, they interviewed about 80 patients to find out the cause of their disease in terms of presentation. And I hope it's projecting well. You find that when they looked at the number of healthcare professionals that the patients had seen before the final diagnosis was made, on the average, most of them had seen more than 4 different healthcare providers. And what that illustrates is that the diagnosis is difficult to make. And so these patients present to multiple healthcare practitioners before a final diagnosis is made. And on this, in this column here, in this column, you find that the delay in treatment for most of these patients was greater than 6 months before the diagnosis was made. And even when the diagnosis is made, before the treatment was started, you had a further delay. So not only are they presenting with very late cases, presentation, but also there's delay in making the diagnosis. And that's because of the lack of facilities for these patients. The other issue is the cost. Some of them, a lot of the patients will pay more than $10 just for transportation, and this is exorbitant for these patients. They also live very far away from the closest facility for treatment, so they have all these barriers to seeking care, which needs to be addressed. Regarding lack of facilities, this is a map of Africa showing the availability of radiation therapy equipment. Now, most patients with cancer will need radiation therapy. The red dots sort of mark the places where there are radiation therapy facilities in Africa. You can see a very large area where there exists where radiation therapy equipment do not exist. Even where they exist, the numbers are so few that they cannot service the needs of the patients. I'll just skip this. Now, how do we go about solving this major problem? There are many stakeholders. You have the non-governmental organizations such as PACHA. You have international organizations, WHO, the International Atomic Agency Commission. Civil societies is a very important group. Groups like you. Governments, although the cost is very high, but it's necessary. It's a cost that the governments have to face up to. And individuals can do a lot to make this condition much better. Academic institutions in Africa have to go into finding the local remedies in terms of making access to care available, and also to study the distribution of disease and how best to care for these patients. This just shows some of the interactions that can be developed, training and research, competency-based training, and the involvement of the Ministry of Health, non-governmental organizations to provide care for the patients. Because most of the patients present with late disease, curative treatment is not a viable option. So these patients will have to need palliative care, because a patient who presents with advanced disease is in a lot of pain, they are very uncomfortable, so palliative care becomes paramount. And the best way to approach this is to involve the community in providing palliative care or giving guidance on palliative care. This is an example from Uganda where the community is being trained to identify patients who require hospice care or palliative care so that these patients can be helped. And I think by engaging the community, you sort of have a multiplier effect in helping these patients. Hospice care does not need to be limited to a center. You have an example here where you have a hospice nurse going to the community. For example, the picture here shows a hospice care person on the roadside helping a client. So this has to be diffused away from the major centers and moved to the community. This is another example of hospice care team in South Africa, where they travel out to the rural areas, communities, to help the patients and engage them in care of the patients. So I'll just end by saying that for an organization like PACHA, advocacy, that was mentioned earlier this morning, is very important, both in terms of lobbying politically, for education advocacy, research advocacy, fundraising, support for patients who present with cancer, and the community outreach program. And I think if we are able to do that, this is just a cover of an issue of Lancet Oncology, which is a British journal, where they highlighted the problem that is looming in terms of the incidence of cancer in Africa and how to approach it. So I think if we all join together, this is a problem that is coming, and unfortunately Africa is not equipped to handle this problem. So the diaspora organizations will be a major contributor in helping alleviate this problem. Thank you very much.